Hello, the topic of this video is patient identification. I will first discuss the importance of correct patient identification. Second, define proper patient identification for both inpatients and outpatients. And finally, I will demonstrate the proper patient identification protocols for each. I will now begin a brief discussion about patient identification. If the incorrect name is placed on a blood specimen, the consequences to the patient may be catastrophic. A mislabeled specimen could result in the patients receiving a transfusion of the wrong blood type, or could change the course of diagnosis, treatment, or medication. All the effort the phlebotomist has expended in obtaining the proper specimen, and all the time and expense the laboratory personnel have spent in analyzing the specimen will be wasted if the specimen is identified with the incorrect name. If the identification of the specimen is in doubt at any time during the specimen collection, transportation, processing, or testing phase, the specimen should be discarded and another blood sample should be drawn. Most experts recommend a two-step process to the specimen collection procedure. As the first step, the patient should be asked to state his or her first and last names. It is not recommended to say something such as, "Are you Mrs. Smith?" A person who is very ill, hard of hearing, or sedated may say yes to anything asked. It is helpful to use a memory jogger, such as having the patient spell his or her last name perhaps. Perhaps the phlebotomist could comment on the patient's name in order to spark conversation. The second step is to make a confirmatory match using the patient's response with the test requisition and some type of identification, such as a hospital identification armband. Now I will define inpatient identification. Inpatients are normally required to wear an identification bracelet, usually on the wrist. Although identification protocol may vary slightly from one healthcare institution to another, the typical ID band lists the patient's name, first and last, and a unique hospital identification number, such as a medical record number. Additional information includes the patient's visit number, date of birth, room number and bed designation, and physician's name. The patient's name, medical record number, and date of birth information on the ID armband must exactly match the information on the laboratory requisition or label. Generally, ID information, such as room number, bed number, and physician's name, are allowed to differ, since the patient may be moved around and may be seen by multiple physicians during the hospital stay. The name card on the bed or door should never be used for confirming identity, because it is often the last thing to be changed when patients are discharged and new patients admitted. What if the patient does not have an ID armband? If there is no ID band on either of the patient's wrists, check to see if one is on the ankle. Intravenous lines in patients' arms often infiltrate the surrounding tissues and cause swelling that necessitates the removal of the ID band. An ID band on an intravenous IV pole or night table could belong to a patient who previously occupied that bed and should not be used. Remember, never verify information from an ID band that is not attached to the patient. The best ID in the case of a missing ID band is to find the nurse responsible for the patient and ask him or her to make the patient ID and then to attach an identification armband before collecting the specimen. Now I will continue on to outpatient identification. Proper outpatient identification is more difficult because outpatients usually do not have ID bands. They often arrive with an order or requisition from their physician in hand. It is equally important to correctly identify an outpatient as it is an inpatient. Each facility has its own protocol for establishing the ID of an outpatient. A patient may be required to show proof of identification, such as a driver's license or other picture ID. They may have a clinic-issued ID card that contains their name and other information identifying them as a clinic patient. ID cards are sometimes used to imprint specimen requisitions or labels. In the situation where the patient brings a requisition or physician order, it is necessary to compare the information on the order with their personal information. Simply calling a person's name and hearing someone respond is not verification. Anxious or hard of hearing patients may believe they heard their name called, when in fact a similar name was called. It is also possible to have two patients in the waiting area with the same name. For assurance, ask the outpatient to state his or her name and spell it if it is an unusual name. And also state their date of birth while you compare it to the requisition information. Complete all information gathering before obtaining the specimen. Now I'm going to proceed with demonstrating both outpatient and inpatient identification. First, I will demonstrate outpatient identification. So I have a requisition and I need to call in the patient. Mark Wright. Hello, how are you today?
Very good, thank you.
May I have you state your first and last name?
Mark Wright.
May I have you spell your last name?
W-R-I-G-H-T.
May I have your date of birth?
July 20th, 1976.
All of that information matches up with the requisition, so I may now proceed with obtaining the sample. Now I will demonstrate inpatient identification. With inpatient identification, I need to make sure my requisition here matches the patient's ID band before I proceed with taking the sample. On the requisition it says Mark Wright. On his armband it also states Mark Wright, with a clinic number of 12345. This clinic number on the bracelet is 12345. We have a match, so we now may proceed with collecting the sample. Now I've explained to you the importance of patient identification and how to correctly ID patients in two situations, inpatient and outpatient. Thank you.